вечір.
Доброго вечора.
Добрий вечір.
Добрий вечір.
Добрий
They
вечір.
all saying hello.
Раді вас бачити сьогодні.
Happy to see you.
Дякую, що ви дійшли сьогодні.
Thank you for reaching us. Thank you for coming in spite of a lot of things happening, lack of electricity and availability of different emotions.
Це бачу Наталію і Ірину Боровик з Тернополя.
I can see Natalia and Irina Borovik, they are from Ternopil, which was massively attacked today in the night. I'm really happy to see you because I know that there are a lot of people who perished today in this attack in Ternopil.
Ну що, ми тоді починаємо.
So I think that we may start.
Orit, can you hear the translation? I just want to check.
Yes.
All right. So we start. I'm Anastasia Ilyukhina. I wrote a book, a non-scary book about life, death, and everything in between. And then, together with a team of brave doctors and medical educators, we developed the guide on how to teach empathy and humanity in healthcare. And some of my colleagues are also here that we worked with together. And you can see the QR code how to get this guide for teaching on the screen right now. Якщо ви не знаєте, у нас є переклад.
Suppose you don't know, we have simultaneous interpretation, and if you need some assistance to connect to the interpretation channel, please write in the chat. But to put it briefly, down on the Zoom panel, you have the globe button or the interpretation button. We have more 3 dots, and there you can actually find the channel you need, be it English or be it Ukrainian. And you can choose just the main or original audio, and you will be listening to whatever is said. And today we have Helena, who will be helping us with interpretation today. I will switch again to English, most probably. So, well, actually, today we have decided to speak a little bit more on reflection in the context of teaching, because it seems to me that we speak rather a lot about the teaching of communications and developments of communication skills, but it seems to me that we already all know that it's really important to get, since there are no prescriptions and no clear truths, it's important to create a space for reflection, to reflect on our relationship with students or with patients, or to reflect and get this self-conscious being self-aware. So I'm really happy that Orit has kindly agreed to tell us a little bit more on how she and her colleagues are integrating reflection as an element of their teaching practice, daily teaching practice. Orit has said that this is one of the priority directions of work of her department, and therefore she focuses on this line of activity all the time. We analyzed your answers, and thanks a lot for filling out the registration forms. And from your answers, we saw that most of you are already using different activities to improve the reflection skills with your students. And today, Orit will tell us more about how reflection became a priority in her teaching practice and in the teaching practice of her department. And it seems to me that this is a very difficult task, because any process of teaching and learning is the best one when you interact with the content, you interact with your experience. And sometimes this comes as the most complicated thing to do. So I'm really happy that Orit has joined us today to share more of her knowledge about that.
I start by asking you, how did it become a priority, and why are you putting so much emphasis on reflection in teaching communication skills and beyond?
So first, thank you for inviting me, and I want to acknowledge that I share the pain that you're suffering now on. We have, unfortunately, in that sense, parallel relationships. So my passion is communication skills. That's where my love is. That's what I was interested to begin with. But I was really curious why we teach communication skills, we talk about communication skills, we explain them. They're very obvious in many ways, you know, the need to be empathic. And we even teach them how to be empathic, but they don't do it. They don't use it. They sometimes don't even try to use it. And that made me very curious in figuring out what's going on. So why is the student not deciding to provide information to the patient, even though he knows that he's evaluated about it? And that led me to focus on reflection. So basically asking that student what went on in your heart and mind related to providing information, listening to the words he used, saying, oh, I can run the patient over with information. And I said, ooh, I would not like to run someone over with something. And then I got to learn from those students that we need to figure out their own barriers, assumptions, ways of thinking, fears, concerns, anxieties, faith that they're raised up upon that creates a barrier to applying skills. And actually understanding this led to a wonderful experience because every feedback that I provide to every OSCE is different than the one I used to provide otherwise. Because I begin with a self-reflection inquiry with the student. I ask them, how did it go? What went well? Why did it work well? What didn't go well? Why doesn't it work? What were your concerns or what led you to act this way or the other? And that is a fascinating road where every student has a different answer. And then my feedback is tailored to their own barrier or to their own issue. And it's not just saying, you have to do this and that. So I fell in love with the idea of reflecting. I must admit something. I am a reflective person, but I think that in my younger years, and I thought it was great to be a reflective person, someone who really analyzes what he does and, you know, what I do and what I don't do. And I really thought, you know, that's my charm, that what moves me forward. And in a way, it's true. But me, like many others, don't only reflect in a good manner that is done in a process that is helpful, but I also ruminate or self criticize myself. And that only makes my life with much more suffering. So learning about reflection helped me realize that there's reflection and it's a process and it has its goals, but it ends at one point and it's helpful for the future versus ruminating and really being cruel to yourself. So what I'll speak about today is how if we learn to do reflection in a timely manner, in a good way, it actually helps our quality of life and quality of relationships versus the other options. And just one other thing is why reflection was so important is that I realized that much of the doctor's work is by themselves. And that no one gives a lot of feedback definitely, even in clinical years, but definitely in the career. And that's why they need to be able to look at themselves from a different eye and look at the interaction from a different eye and be critical and be reflective about it. Otherwise, they'll practice, but they won't really get better. So
Great. I'm very curious about the whole connect, like how to reflect and not just self-criticize. But maybe we could go to that a bit later. I don't want to ruin the order of your presentation.
yeah, so we'll talk about reflection, and we'll talk about the fact that we have to constrain it or to caption it to reflection and not the self-criticize. So do you want to
Yeah.
open?
And I think I mean, there were quite a bit of questions asked in various forms about what is a meaningful reflection as opposed to meaningless or damaging reflection. So I hope we can go into that in more detail.
Yes, and if it won't be clear from this, please let me know and I'll answer this more because it's a critical question. Okay, so let's begin a little bit by reflection. I would say that Nastasia asked me before, who do I give this presentation to? And basically, this presentation is given in the international conferences of communication in healthcare, that's fine. In a paper, that's fine. But I give this presentation to our medical students in their first day of medical school. And I give this presentation to our small group facilitators who teach communication skills and those who teach professional identity formation in their first or second time that they work. So this is a part of our basic teaching. But let's talk about what is reflective ability and specifically in teaching communication skills. As I said, I'm from Israel. I feel very committed to you guys in Ukraine. I feel for you. I care for you. And I hope this terrible war will end. Should have ended. So we'll talk about what I'll do today is because reflective practice and reflection has a lot of definitions out there. So what I'll do is try to create a working definition for all of us that would be clear in just one. We'll talk about the importance of reflective ability to students' capability to communicate well. And then think a little bit about how it could be integrated in teaching communication skills and in general professional identity formation. This is the only one in Hebrew. But what I show students and our professionals at the beginning is that reflection or reflective practice is a multi-faced, very challenging concept. So it is a lot of these things that you'll see in a few minutes in Ukraine, in English, but it's a challenging process and it's a challenging term that we're not born with. We actually need to learn and we actually need to practice. So let's dig in. First, I would say that it's sometimes very funny for me that people say that we teach communication skills or reflection. It's the non-cognitive issues. And I say, no, we teach very, very cognitive issues. So reflective practice is actually a metacognitive process. It's something of a way of thinking about my thinking and thinking about my way of action. So it's a metacognitive process and a strategy to develop my ability to first understand myself. What are my thought processes? What are my emotions? What are my beliefs? What are my assumptions? What was I raised on? How do I act? What I am? And many people understand this concept in reflection and they sort of relate it to self-awareness, which is a critical part of reflection. But reflective practice is not only about self-awareness. Actually, and this is the reason it's very relevant to communication skills, is that reflective practice is also about really enhancing my understanding of others. So if I'm with a patient and something happens, I want to figure out what happened. Why did that patient reacted in the way he reacted? What might he have thought? What might he have felt? What might have been his assumptions or his beliefs that played a role? And this is not the only part, because I also want to enhance my understanding about different situations. So, what does a patient need in acute care versus in a really regular community family visit for the family practitioner? What are the different situations and what are the different needs? How I react at 4 a.m. in the morning versus at 8 a.m. in the morning, okay, after a long day. So reflective practice is actually the ability to check what's happening with me, what is happening with the other, and what context played a role and in what manner. Reflective practice is the capability to review, to interpret, to understand, to resolve experiences in ways that will allow me to achieve deeper meaning, some kind of an insight, and guide us to future behavior. These are a lot of words that I'm going to dig into right now. So when I say reflective practice is first understanding myself, it's an in-depth consideration of events or situations. Asking myself, what just happened here? Okay, it could be in my teaching practice. So if I teach a small group and something is happening there, I don't know why the students are, they didn't feel comfortable, they didn't really share their challenges, something is going on. If I do a reflective piece for myself, I ask, what was happening there? When did it happen? What was said? What was done at that point that led the students to disconnect from what I was teaching? Then, what did I feel? What happened to me? Okay, if I have a patient that I'm starting to feel angry toward, I need to figure out why. What's going on? What is the feeling I'm feeling? Why am I feeling this way? What am I thinking? We all know that our thinking and feelings are very much connected. So, what am I feeling? What am I thinking? And why am I thinking this? And what does it mean to me? Okay, what's going on in my mind? What's going on in my heart? What's going on in my belief system? And what are the consequences of these? Okay, what happens to me in those kind of situations? I'll give you an example from now. We've talked with Anastasia, and then she had a great idea of starting on slide number 31. Okay, for me, saying 10 minutes before, start on slide 31, I say, okay, and I think it's a great idea. But I know myself, and being stressed and doing something 20 minutes before a presentation, changing the whole presentation, is not a good idea for me, even if it's a great idea for the presentation. So that's part of knowing who I am in order to handle something, which is very important in the way I would handle it. And then I look at the event and say, okay, who else was involved? There was a patient. What happened to him? What might he feel? What might he think? What is the meaning for him? Okay, why did this patient become so impatient? What might have happened to him? And this is a hypothesis way of thinking of what's going on to really get to a more in-depth understanding of this. So when we do reflective practice, we actually want to look at the whole scenario from as many angles as possible, figuring out the people who are present. Maybe it's the patient and maybe it's the family member, and definitely it was me. What is the situation? What is the place? Where did it happen? Was it in a private place? Was it in a public place? What was happening there? What is the connection and relationship? Is this a patient that I'm connected to, I care about, he's similar to me, or he's very different? How does that impact me or my answer? What is the timing and chronology? Okay, it was just before lunch, or it was just after a conversation with my husband, or it was just after my boss just said something bad to me, and maybe that led to my interaction getting interrupted. And what were the causes? Okay, so what happened in that interaction that allowed me to figure this out? And in this sense, reflective practice is a mind exercise. So we want to do exercise for our body, for many things, and that's a very important thing. But reflective practice is actually exercising our mind to think more deeply about ourselves, more deeply about others, more deeply about the situation, trying to figure out what is going on in this interaction. Another part of reflective practice, and that's a critical part, is that we want to connect between our past, our present, what is happening right now, and our future. So in order for me to do this, if I'm in an interaction and something is going wrong, I just actually need to slow down to allow myself not to be on automatic and to figure out what is going on here, what is happening to me, and what is happening to the other person. Or if I'm after that encounter, I need to stop and turn back and try to analyze and figure this out. I analyze the situation that is going on and that is challenging, surprising, confusing. When I invite people to do reflective piece, I say, take something that is puzzling, something that happened, and you're not sure what happened and why this happened to you or why you reacted in the manner you reacted, because that's a great opportunity to try and figure this out. So if we want to connect our past, present, and future, we have to dig a little bit in our past to explore our beliefs, our biases, our perceptions of self and other, to better understand what happened to me in this situation, what happened to him in this situation, and why. And when I speak about the future, is that I want to do this to really learn a lesson, that it's something that I may be doing differently next time I encounter some kind of an interaction that is similar. Or if I do a reflective piece and I figure out that I did a good job, then what do I want to do next time that would continue to allow me to achieve that good achievement? So in a way, reflective practice is challenging our own assumptions of everyday practice and critically evaluating them. So it's not assuming on a track and an automatic track, but it's actually slowing down and thinking about things and doing some kind of an iterative process to allow us to develop. I will give you an example. So when we teach basic communication skills, the medical students meet with a standardized patient, and they have their interaction with that standardized patient, interviewing them. Following that, we have
Sorry, when you say standardized, it means simulated, right?
standardized patient is an actor. It's a simulated patient. Yes.
Okay, thank you.
Yes. Okay. And then they are with me in their feedback. And every feedback from my perspective begins with my invitation for them for reflection of learning what they felt, what went well, what was challenging, why it was challenging, etc. So one day I was observing Sarah. She was an MD student who is also a registered nurse. And she had an encounter. I would say it was not that great of encounter. Of course, Sarah is not her real name. And I first invited her to share her experiences of being a nurse and actually doing the simulation, because it's not easy to be in a job and then doing a different job of being an MD student. And Sarah said, well, I guess it's okay. Some parts were easy and similar to what I do. Others were different. Some I did well, though sort of trying to move us forward. But I'm insisting. And then she says, I didn't really address the patient's emotions. That's interesting, because when I do a reflective process, some students are actually shortening my inability or my reluctance to ask them about the issue that I'm actually concerned about. And I was definitely concerned about her not addressing the patient's emotions. So she gave me the gift. She says, I didn't really address the patient's emotions. And I continued asking her. And she says, well, I know about empathy. And, sometimes if needed, I can do this. But really, how can I help them? I would say that maybe my instinct many years ago would say, oh, I can tell you how you can help them. But no, I said, she's giving me another present. What's going on here? And so I asked her a little bit more about it. And she say, I can't really take away their suffering or change their life situations. Now, this was a simulated patient. She was not expected to change his life situation. That was a weird concept from what she said, which makes me say, I want to hear more about this. And then she said, I don't want to be their punching bag, neither for the patient nor for every person out there. These are important hints of things in the past that play a crucial role in the way she acts in the present situations. So obviously I asked her. And she said, as a young girl and teenager, adults used to share very difficult things with me. And I couldn't quite deal with this. I hated it. So I heard a little bit more about this. And then first, I was very empathic to her experience, saying, it sounds like you have been struggling for many years with people sharing personal, emotional issues that were overwhelming for you. In your work, this became a day-to-day challenge. You fight yourself, because that's what I felt from her, because you do notice the emotion, which is, by the way, a very important part, and she notices the emotion, but decide not to deal with it. You're concerned about its impact on you and the feeling of being incapable to really help. So I was actually acknowledging and giving legitimation to her concerns and to her fears and to her anxiety. And then I asked, are you willing to address this challenge with me? And we talked about the impact of not dealing with emotions, of what it cost for her, what it cost for patients, and the possibility to help others when actually addressing emotions. And it was all taught in the course. But she couldn't listen to this before someone acknowledged her own challenges. And then we talked about the need to really have a tool to help deal with emotions. And when she said, okay, I'm willing to hear about your tool, and my tool was a tool that actually allows you to address the emotion, but then pack it up. She was willing to practice this with me. And at the end of our meeting, I said, you're a nurse, you see patients every day. Please feel free to try this. And luckily, a few weeks later, I received an email and she said, Shalom Orit. After our talk, I decided that I do want to try and explore and deal with patients' emotions. A patient after a car accident arrived. She was very emotional. Usually, I don't get along with these patients. Do you see her mindset? I don't get along with them. They have this stigma. I become frustrated from the drama they create, not being able to calm them down. I usually label them as hysterical leaving this part of the care for their family members. Oh, and they usually don't do a great job. So I thought to myself, here is my chance to check out this empathy tool. And I did this, and she elaborated to me what she did, and then she said, and it worked. Instead of her crying and being overwhelmed and uncooperative, leading to yelling and tears, she shared her emotion, cried, and calmed down. After this, she agreed to listen and collaborate with my care. This was a one-time experience, of course, just labeling this, though I plan now to keep on trying this. It was surprising. This patient turned from being unbearable to someone in distress, that I can understand where the distress comes from. I'm listening to this sentence and I'm thinking, Sarah, when she met me, was a person in distress. And I came through reflective practice to understand where her distress comes from. And only when we acknowledge someone's distress and they realize it, we can actually try to help and move them forward to teach other things. So she said, I still need to work on it. Try it. Think about it. Will do. Thank you. And that was her experiences. And from what we know about this, and bringing us back to reflective practice actually focuses on 3 aspects. So it focuses on the emotions, okay? Emotions are a big barrier or difficulty to taking different tasks on ourselves. Okay, she was emotionally scared of opening up Pandora box from her perspective for emotions. And reflective practice is about the cognitive, okay? The interpretation that I would give. She's hysterical, this is drama, nothing can help her, I'm not the one who can help her. And reflective practice has behavioral actions. So it could be ignoring her emotions before or deciding to try it out and address her emotions later on. So reflective practice focuses on all 3 dimensions, and it has implications on all 3 dimensions. And in that sense, Gibbs talk about this cycle of figuring out what happens with a description. Once again, we need to understand what was the experience, what were you thinking and feeling, what was good and bad about this experience, that's what I don't see here. What sense can you make out of this experience? What can I learn from this? It's actually learning to be a researcher in that sense, about a researcher of myself. What do I need to improve on, or actually to maintain, and how I will improve? It's coming up with an action plan of thinking, what will I try? And it shouldn't be a dramatic thing of changing all I do, but it's a one small task, skill, tool, attitude, exploration that I can try later on. In fact, and Anastasia, you can feel free stopping me whenever you want, but I would say that reflective practice is relevant and very critical to the core competencies of health professionals. And when I say core competencies, I say that it's related to their expertise. So they have to have clinical reasoning. They have to understand and diagnose. And reflective practice is very helpful because it actually, I can ask myself, what made me decide that this is the diagnosis before I collected all of the information? Why did I do a premature closure? Why didn't I ask those questions? So it's very relevant to that part of life. It's very relevant to the scientific reflection. Scientific reflection is not only a researcher, but is a scholar, someone who knows. So it's asking myself, what do I know and what don't I know? And how do I learn, and how I can actually fill this gap of the things that I don't know. And of course, to the personhood. personal reflections, the affective, attitudinal dimensions of who am I as a person. Because when you think of it, most physicians or most medical students who come to medical school do want to be empathic at the end of the day, do want to be caring, but things happen on the road that make them build a wall, learn bad habits, become scared of doing those processes. And we want to help melt those down. We want to help actually bring in the personhood that they're talking about. And what we have seen from different studies is that reflective practice is actually associated to all of those three topics. It improves clinical skills. It decreases diagnostic errors. It is associated with less professionalism violations. It is associated with more coherent professional identity formation. It is associated with higher empathy, and it's more tailored communication. So if you ask me why I focus on this, because I think it's the piece that actually makes the huge difference on all aspects. If I can look at myself from the terrace and figuring out what's going on here, or I can look at the interaction from the terrace and try to figure it out in a systematic manner to understand what's happening and what needs to be done, I can actually improve. For me, I can tell you that I hate people who say, with practice comes learning, or with practice comes excellence. I say with practice and reflection, excellence will come. Otherwise, we sometimes just do our same wrong habits or mistakes, but we continue doing them all along the way. So I started providing a working definition, but now let's look a little bit forward to recognize the importance of reflective ability to students' capability to communicate well. So in public health, they have this concept of primary prevention, secondary prevention, and tertiary prevention. And I take this to the levels of reflection. So primary prevention, before something bad happens, is actually related to reflection before action. And I'll talk about it a little bit more. So for example, if I know I have a challenging encounter with a patient that last time it was catastrophic, it's better for me to prepare toward that interaction and think what can help me make this interaction better. Secondary prevention is actually reflection in action. So if Anastasia wanted the tool not to need to do a lot of self-criticism and rumination, reflection in action is the best manner. Because if I'm in the interaction and I see something going wrong, and I don't tell myself, oh shit, it's wrong, I can never fix it, and then it goes even wronger, then I actually at that point slow down and say to the patient, I think I scared you now. I think I said something that didn't work for you. And then the patient feels that someone saw him. And he says, yes, you said that this might be a very dangerous disease. And I was, whatever it is, and then I can fix it. So reflection in action is actually the best manner because I can fix things if I notice that something is going wrong on the spot, and then I have less things to knock on my head at the end of the time. But the most prevalent, especially in the medical education field, is the tertiary prevention, which is reflection on action. So we had an encounter, and then we look at this back and try to figure out what's going on. And it's important and it's critical. And some would even say, you know, it's a way of reflection before action because I will have another encounter. It would be relevant to there if I learn something that is relevant here. So let's talk a little bit about these. Feel free to ask questions. Anyone? Yes.
So in a way, what you are saying really makes a lot of sense. But as a devil's advocate, I keep thinking, well, but this is like in perfect conditions. But we don't live in the perfect conditions, and there is never enough time. So it's like we often choose to act and not reflect. I mean, I don't mean to say being thoughtless, but not to give too much time to thinking. And I mean, I think we also, a lot of people shared that the stress and exhaustion it also take their toll, and that makes it very difficult to do the reflection. And I think even when we teach and when I see other people teach, it's all often the case that like the actions are there, the theory are there, but there is never enough time for reflection. Somehow it often slips away. Yeah, so how do you really find time for it? How do you make proper time for it?
At the end of the day, I relate to this, of course. Okay. But I would say that at the end of the day, if we don't make time for this, it would cost us a lot more time. Because if we don't, for example, acknowledge our stress or acknowledge that because of the war, we're really unavailable or we're shorter, for example, in our answers, or we're not feeling capable of being empathic to specific patients or to specific complaints when something so big is going on, then we'll have much bigger problems because we'll get into a lot of tackles and we'll find different problems. The idea of reflection is figuring out first what's happening to me. It's sort of paving the place for myself and figuring out what is the toll of these things on me and what do I need in order to be the better self I want to be. Because if I won't be the better self I want to be, that has a huge toll on me. And that's a vicious cycle that we go into. So we have to carve the time for reflection, or maybe figure out on what topics we need to reflect, or who is the good reflector that can help us in reflecting on those things. Okay. So what is reflection before action? Reflection before action is called anticipatory reflection, and it helps us prepare toward things. It's awareness to our own feelings, thoughts, perceptions about self, others, and the situations, assessing our own needs and wishes. It's really placing ourselves for a second on the plate and seeing who we are. And I think this is a big part of reflection. It's a big part of saying, I'm a human being. I have my own challenges. I have my own great things, but I need to pay attention to who I am. And then thinking about also the needs of the others or what they might need in order to prepare better to do this kind of process that would work well. So what we'll do right now is I'll show you a case we give our medical student. Yeah.
Sorry, there is the question from Lubov in chat. And Lubov is saying, in a way, all of us kind of know that we need to reflect, but then how to do it quickly in action, how to speed it up.
So I would say that usually in action, we don't reflect. We work on automate. Like in an interaction, we sort of don't stop really to reflect. But when we see something going wrong or going strange, then we have to slow down a little bit. I would say it saves time, as I said, so we have to slow down. Part of it is learning what I need. Okay, I know I get stressed if I have to do a presentation, even though it's ready for a while. But I know that if it's not ready a week before, that makes me stressed. And that adds to my inability to act. So knowing that creates a situation that I carve the time for presentation a lot beforehand. So I'll be not stressed. Okay. It doesn't make time for me that is different, but the time that I work in it is not when my head is too overloaded. So we carve, for example, there's no simulation with simulated patient, with standardized patient, that there's no reflection piece immediately after that. The first thing we do is ask our students, how are you? What did you feel went well? What did you feel didn't go well, and why? It's critical for their ability, for my ability to tailor the information to their needs. And it's critical for their ability to be available and to create a space in their life to hear about it. So I would take off one advice that I would give toward asking them to reflect. Okay. So it's not that I reflect all day, because then I wouldn't do my work. But when there is a situation that is challenging, that I didn't act in the manner, or they didn't act in the manner, then we do the reflection. And I'll show you pieces of how we do it.
And then can I just really quickly, because I think it's related. So if you see that something is going wrong in the simulation, like, do you slow people down to reflect on it in the moment, or do you let them finish and then reflect?
Great question. No one answer. So what we say to our students is, feel free to stop the simulation if you feel that something is going wrong. Not in the test, not in the OSCE, but usually we say, if you feel, it's not an exam, if you feel that you need to stop, stop. But most medical students don't stop, even if it's going terribly. And it's always a dilemma when to stop them, because that could be perceived as a challenge. So I did have a few times that I stopped people and I came behind them and I said, what do you need right now? Do you want to stop? But it's rare. I just remind them of that option. And then we go back to that point. I did have a student in an OSCE that I saw him just really in a Breaking Bad News OSCE, just going down down the cliff. And I said, wait, let's stop for a second. And I said, what's going on? Okay, what's happening to you? And he said, and I asked, is there something that you think you would do differently? And he said, yes. I said, restart. That's fine. Sounds like a perfect plan. Restart. And he just restarted it. Okay, and the experience for him was so great. So if they don't stop during that situation, we would still go back to that minute and even do a retake. Okay, after figuring this out, after thinking of the dilemma, and then do a retake of that dilemma and thinking, okay, how could I dealt with this? So I said this term and the patient became pale. Okay, it happens. We all make mistakes in our communication. No one's flawless. Let's think how we can try to fix this on the spot. And then they practice from that point of view, because I want them to feel that they have the efficacy to deal with it. So I've been blabbing, blah, 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 your head off. So now I want you to think a little bit with me. I'm going to show you a case that we have shown our medical students quite often. And when you think of that case, think that you will be the family physician who needs to share the news later on with the patient, and think what would be challenging in this case. Okay? So you're a family practitioner in an urban clinic. Yael, a 45-year-old woman, is a personal manager in a high-tech company. This is the second time you're seeing her as a patient. However, you remember her as a daughter of a long-term patient who died of pancreatic cancer 3 years ago. Yael, as you recall, was an especially devoted daughter, deeply involved in her mother's care, investing time and financial resources in trying to save her life. Yael's mother died after a long period of suffering in an internal medicine ward in a hospital. You visited the family during the period of mourning and remember Yael's anger over the doctor's refusal to assist her mother achieve a dignified death. Yael is a mother of 3 sons, ages 4, 16, and 21. Her husband is a lawyer, and the family is financially well off. Her father is 78 years old and self-sufficient, but with hypertension and diabetes. 2 weeks ago, Yael consulted you with a complaint of several months, suffering from severe headaches. She mentioned occasional nausea and 2 episodes of vomiting. Yael initially believed that she might be pregnant, but this was ruled out. In the course of your initial conversation, she mentioned that her closest friend has recently been diagnosed with metastatic cancer, breast cancer, despite regular checkups and a recent negative mammography. Yael admitted to being extremely anxious and is certain that she has a brain tumor. Her physical examination was normal, and you have tried to reassure her and allay her fears. Nevertheless, you referred her to a brain MRI. A few days later, sitting in your office with 20 patients scheduled for a day, 5 of whom are sitting in the waiting room, you have just received an urgent telephone call from a radiologist colleague who tells you that the scans performed the previous night show that Yael has a brain stem tumor. The results are faxed to you with an unequivocal diagnosis of glioblastoma multiforme. So try to figure out for yourself what challenges you have noticed in this case. Maybe write them down for yourself just for a second. You can write in the chat, but I wouldn't know how to read it. But Anastasia, you
Oh,
can.
I will. We figure a way. Let's write it in the chat. Може, ви напишіть в чаті, які ви бачите
Yes, you can
виклики.
write it in the chat. What challenges do you see with this case?
If you were the physician, the family doctor.
Ну, якби ви були сімейним лікарем, що ви тут бачили? Який список викликів?
Yes, if you were a family practitioner, so what kind of challenges would you see here? You can actually add it one by one, and maybe in this way we will get the full list altogether in our chat.
Можете просто як надрукуєте один.
And that's fine if we don't
відсилаєте.
have it. Do you want me
You can
to
just
continue?
give it one by one.
Yeah, we can continue. If people wrote it down for themselves, that's fine as well. You want me to continue?
So we actually started getting the. So one of the challenges is how to deliver the bad news.
Mm-hmm.
And then another one, it's difficult to manage myself as a doctor and to start seeing patients that are waiting for me.
Yeah.
I will start thinking that I may have made a mistake.
Yeah. Okay, I'll continue and you can continue thinking. But when we think of the challenges, what challenges you have noticed? Is it the fact that she's 45 years old? You know, for me, it's young. For the students, it might be old, but it's young. Devoted daughter of a patient who died after suffering. Maybe her anger over the refusal to help her mother have a dignified death. Maybe her children's age, 4, 16, 21. Her husband, he's a lawyer. That might be a challenge for some students. She believed she might be pregnant. How different thinking you're pregnant versus this very terrible disease. Her closest friend diagnosed with breast cancer despite checkups. So there was like a delay in the diagnosis of her friend. Yael already is anxious. How do I deal with that emotion? You actually reassured her. You thought it was nothing. Is that a challenge for you? 20 patients, 5 already waiting in the waiting room. So thinking about our way of thinking is figuring out what we actually see in a case and what we don't see in the case and how that impacts our way of behaving. And this is one of the studies we have done. We actually qualitative analyzed 112 senior medical students' written descriptions of this case when they identified the challenges for them, and then they actually communicated the news. So Yael's case includes, yeah.
Sorry, can I just like jump in here for a second? I'm just noticing that the answers we got in the chat, they all relate to the doctor's picture, like doctor's challenges. But the ones that you are giving on the slide is actually related to the patient's challenges. And that is like super interesting, like the different perspectives that you and our participants decided to take when answering your question.
I completely agree, and you'll see about this in a second, okay? Because sometimes the same challenge could be a doctor's challenge and a patient challenge. So you remember that we talked about the self and the other. And part of it is thinking, what is it about the self and what is it about the other? And same issues were interpreted differently. And I'll talk about it in just a second, exactly what we showed. Thank you. So it included 19 different challenges. Of course, no one noticed all challenges. Okay, it's quite a big task. 11% noticed up to 4 challenges, so less than 4 challenges. 10% noticed more than 10 challenges. And the mean score was 6.77. But what was really interesting is that the manner of noticing and interpreting the challenges was different between students. So some students only noticed, they said, okay, she had a mother with a terrible illness or a challenging death. Some student noticed and tried to understand the implications. So she had a mother with a terrible death, and that may impact the way she perceives cancer. For example, that's not only noticing, but it's also adding some kind of an interpretation. And some went far away with a deterministic interpretation, saying she had a mother with cancer and the mother had a terrible death, so she definitely wouldn't want to have any treatment. Okay, jumping to that kind of conclusion. And what was, of course, interesting is those who didn't notice an issue didn't in any way or in any manner prepare toward that issue that they haven't thought about. So do you remember our talk about the brain
Аня,
exercise?
двері.
So part of the brain exercise is really allowing myself to notice different issues so I can get prepared to different challenges that might exist in that interpretation. And then it comes to what you said right now, Anastasia, that was fascinating, okay? Different students perceive the same challenges differently. Some focused on the patient, saying, for example, her fear of pain, her loss of independence, her loss of independence, and stuff that may make it easier, difficult for her. Some focused on the physician, saying the 20 patients or her fear of cancer may make it difficult for me to explain to her how to why this is a different cancer and why she does need to get treatment. And some focused on the relationship. So that would make a challenge of us creating trust because she had a bad experience with her mother and with me. So it's very interesting to figure out who I'm focused on. If I'm only on the patient, then I'm neglecting my own needs. If I'm only on the physician, then I'm not prepared to the patient's perspective inside, and that could also be something that I can work on and think about. And for example, the patient experienced with her mother cancer, it could be bad memories that created fear or concerns. For the physician, she might be feeling despair, skepticism. I need to convince her about treatment. And for the relationship, I need to build trust. So when we did these vignette exercises, we allowed the students to think about their thinking, to identify their emotions, to identify what they see or notice and what they don't notice, to identify what they interpret very far in a deterministic manner versus asking questions or hypothesizing things, and to learn about their attitudes and ways of relating. And this is very critical to managing the encounter. And this study and the former study that we had about the impact of students' personal difficulties in their communication patterns and breaking bad news led us to the need to focus on anticipatory reflection. So reflection before action, saying if you have a case that it may be challenging for you, you need to identify your own emotions, perceptions, difficulties, and need. You need to think about the other person and then find ways to deal with these challenges. So today, when we teach breaking bad news, we teach the protocol of how to break bad news. We teach their splices protocol, but at the same time, and every time before, we teach the pre-splices protocol of preparing, of thinking, you get this case, what's going on with you? What might be difficult for you? What might be challenging for you? What might be difficult for the patient? What might be challenging for the patient? And how do you want to support yourself and the patient in doing this? So we call this the pre-splices. That is based on the spices protocol. Don't worry, you don't need to read this whole interaction. But it's talking about what's difficult for me in the setting, what's difficult for me about the patient information, what's difficult for me emotionally, and not less important, what can help me in handling this better. Okay? So for example, when I did it with a student of mine many years ago, and she was a very student who was very empathic and great and stuff like that. And she was like, she read the case, she did the pre-splices, and then she came back into the room and she said, sorry, I'm organizing the room differently. I'm going to sit behind the desk. And I was sort of surprised. I said, wow, she's sitting behind the desk. She's the only student who decided to sit behind the desk. That's interesting. And she did the simulation. She was great with the patient. She was wonderful. But when she finished the simulation and the reflection piece, I asked her many questions. And then I said, so tell me, please, you decided to put the table. What made you decide this? And she said, I did the pre-splices and I needed to share with the patient the fact that her pregnancy she's losing her pregnancy or pregnancy loss. And I felt that the fact that I'm pregnant is a barrier for me. I felt that if I sit in the regular chair, my belly is a barrier to our communication. It would come between us. So I wanted the desk to protect me. And this is just one example. But the fact that they notice what they need brings them into the conversation better prepared. Another student said, we talked it through and we walked on what was difficult for him. And he said, and I said, okay, so what can help you? And he said, I want someone else in the room with me. And I said, okay, who would that be? And he said, this student. And I said, okay, and what will her role be? And he said, I just need her to sit just behind me. That I know I'm not alone. That I know I have my back. And that's what she did. She just sat there. She didn't open her mouth. And he was so available to the patient because he felt protected at that point. So a big part of this reflective practice is acknowledging the student, the medical professional as a person, and acknowledging their needs and acknowledging their, yeah.
So, question from Natalia, how much time do you usually have to discuss with each student, and like how do you manage it time-wise in the middle of your classes? Because I guess it feels like a really big task.
It is. And you know, full disclosure, I'm not good at time because I love those conversations, so I'm not good at this. But when we have a 15-minute simulation with a standardized patient, we have 5 minutes for the reflection and then 15 minutes for the group discussion, which is also part of the reflection, but it's part about the feedback in general. So we all, or if I do a test, I do a OSCE test, and I have a 15 minutes feedback time, 2 or 3 or 4 minutes from it is only about reflection. And I would also say, someone asked in the survey, we give an assessment, we give score to that reflective piece. So you may have been terrible in the interaction, but you were very reflective about it. It's 10% of your score. Okay? Because this is what we want you to learn. It wouldn't pass, you know, if you're terrible at the interaction, you wouldn't pass the test if it's that, but it's 10%. And it could bring you from 90 to 100.
So can I just repeat 15 minutes exercise, 4 minutes reflection, and 15 discussion, is that right?
If I have for feedback 15 minutes,
Uh-huh.
then at least 3 or 4 minutes would be reflective. And then I'll have the other 11. It would just change my interaction in the dialogue later on. And
But
I tell my
basically, sorry.
I tell my
Basically,
students, it's just, I'll just say one thing. For me, when we teach our way to handle the interview with a patient, we always say you begin in investing in the beginning, asking the patient about their story and about what they're on, and investing in that part. And that's what we also do in the reflective piece. I invest in knowing who is the student in front of me and what are their challenges.
so basically there is almost more time that is invested in reflection and discussion and feedback altogether than in the exercise itself or the case.
No, usually we do have a 15-minute simulation and then 15-minute feedback. But from the
Okay.
15 minutes feedback, 2 or 3 minutes would be invested in the reflective piece.
Okay, thank you.
Yeah. And in teaching Breaking Bad News, we invest time on the anticipatory reflection. And I think it's a huge thing in their action. I'll go fast about the reflection on action because it's something that we all do a lot more often, but it's thinking about a situation after it occurred to really expand our understanding. It's the most common form of reflection, and we use it quite a lot. We had a paper named See, Reflect, and Learn More. So in our Breaking Bad News course, for example, we ask students to reflect not only about what they've done, but they also go out to the clinic, see different experiences, write a reflective narrative about those experiences, and then they receive feedback from our physician about their reflection, which focuses on the content and on the reflective capability. That's a whole set of presentation. And then they have a group discussion about those narratives and about what they can learn out of it. So what we do is we enable students to think and write about meaningful experiences and events. So we actually force them to pause, to reflect, to process, to delve. You know, a student can come to me after 6 years of medical school, 3 years in clinical years, and she said, I've never seen a Breaking Bad News encounter. No, that doesn't make any sense. Of course you've seen, but you just haven't noticed that this was a Breaking Bad News encounter. Okay, So we force them to go out and see those encounters and figure out that this is the case that they're actually seeing. And then to examine what happened, what they felt and thought, what were they underlying attitudes, perceptions, and insight, what were their patterns of behavior and thinking, and then really figuring this out a little bit more to draw conclusions on future adaptations. So what we saw is that when students were invited to observe and reflect, it actually provided them with wealth of learning opportunities. First, they were invited or went into these encounters, and they need to see them because it's very important. So it enhanced their awareness of the bad news and understanding that it's relative and subjective, and that a lot of tiny news are bad news for patients, which is very important. It shed light for them on patients and families and physicians' own experience and needs. So they had to analyze it from the patient's perspective, from the family member's perspective, from the physician perspective, trying to figure out why they acted the way they acted. And again, it's the mind stretching to actually see it from different perspectives and not only from one point of view. It revealed the importance of the protocol of breaking bad news. So they had to analyze the protocol based on what happened versus what they would have done now when they see the meaning of what happened, and learning, and it made learning much more applicable, both from positive and negative encounters. So we know that, many times you say, oh, you learn from someone what not to do, but it's not true. If you don't reflect on it and you don't get into the lessons points, okay, how would I do it differently? What would I do differently? You just know I don't want to do this, but you don't learn a different way to do this. So part of it is really focusing on the future and saying, okay, in this kind of situation, what would I do differently? And this is what we ask our students to do. And the last piece that is much harder to explain and do, but we wanted to know if really your reflection is related to your communication skills, because, well, we invest a lot of efforts in this, but does it really have any impact? So what we actually do is, so reflection in action, just to remind us, is during the doing stage, awareness of what is happening in the encounter while you're in it, allowing you to react and change the event on the spot, and identify misunderstanding or surprising emotional reactions. So it's when I identify that something went wrong and I fix it. And I tell my students immediately, we all make mistakes in our communication skills. We all do them. The issue is not to make the mistake, it's to identify it and to figure out how to fix it. If we fix it on the spot, it's much easier or better to deal with. So we measured students' reflective ability on their reflective narratives. How reflective are they? And there's differences in students' reflective ability. And we've measured in their OSCE their communication skills. So how did they break the news? How well did it go? What happened? And what we saw is that there was an association between your level of reflection and your ability to break bad news in a positive manner. So if you were more reflective, you were more likely to be a better communicator, which is an important lesson for us as communication skills teachers. I must say that reflection can be done in various different ways. It can be done by self. What, you wanted to ask something?
Yeah, I wanted to just jump in, and we are also like slowly running out on time. And I just want to ask you, I mean, related to this this capacity. I mean, what you were talking about is like students need to know how to reflect, and they need to have certain skills to do it. And then I think that the people, some of the participants who are here today, wrote in the forms that among the key barriers to using reflective tools is like that students don't know, they are not aware, they don't understand why it's important. They also have low capacity for self-analysis and they can't really recognize their emotions because they were not really taught in school to do it, or maybe their parents were not so reflective, like you need to get it somewhere. So you end up working with students that don't have these capacities and skills. And I understand that you are sharing the why it's important from the very beginning, but then how do you help them grow these skills in the middle of this training when the basics are just not there?
Yeah, so you're asking this just in time, because I would say that we can do reflection by ourselves, but many times we'll be stuck by ourselves and it's not enough. Okay, that's part of the deal. So I have to do the reflection by myself, but I may be very limited with this, or maybe going to rumination and not really getting somewhere. So actually the best way to do reflection is in a couple, in a dialogue. And someone asking you those questions, someone emphasizing this, someone dealing with this. It's a skill that needs to be practiced and learned. Again, it's not something that we are born with. It's just like when I'm teaching communication skills. Some people have it a little bit more and some people have it a little bit less, but everyone has, or we can teach it, or we have to teach it. And then we can also do this in a group. So we work in groups, and in a group, if you have reflective questions and you have opportunities for different perspectives to come in, then people can expand their way of thinking of, so they can learn about others. So if in a group discussion we talk about organ donation, then they can learn about different perspectives about organ donation. Okay? Or if we talk about stress and dealing with stress in a reflective dialogue, I allow them to learn that different people experience stress, but they experience differently, or they have different ways of dealing with stress. And then they can have that kind of discussion. And we also do this a lot of face-to-face with a lot of empathy, as you've seen, and I said. We do this written, and we do this with other creative manners. For example, we ask students when they're just in the first week in the clinical years to think about an experience. We know that they didn't want to write something. So we were like, okay, we have to figure out what to do to have them stop for a second and figure out what's going on. And in their first week in the internal medicine department, we told them, please send a picture, a poem, a sentence, or anything that represents your experience in the first week in the internal medicine department. And this is what a group sent. Okay? Different poems we see, and that's fascinating. 3 fish, okay, in this. Someone said, hello, first grade. Someone says this picture, and I say, wow, what it means. And then we put it on the wall and we say, let's talk about it a little bit. Okay, so they focus on themselves, figuring out what's going on, but they read other experiences and they can talk about it. And this is part of the group discussion that allows reflective piece within it. And we teach reflection. As I said, this slide is given on their first or second day in medical school. We talk about reflection and we talk about its importance in their medical career. We write them very clear instructions of how to write reflections with rich description, identifying dilemmas and issues, focusing on self, observing and deepening the understanding of other, and significant lessons learned. If you see the resemblance to the definition I gave about reflection, it reflects directly to what's happening in this description. And we write to them why they need to do this. And when they get feedback, the feedback is about this. And this also relates to what you said. It's not about the writing alone. It's not about the student alone. It's about us as teachers and educators. We have a role here of dealing with the content that they're bringing, but not less about the reflective capacity and allowing them to develop in that skill. And in that sense, reflection is part of the assessment, because if you don't evaluate it, they don't value it. And that's why the reflective journals get a score. It's not about the content, it's about their reflective level, their reflective capacity. Their reflection about an observation gets a score, because that's what we want to actually move them forward. So we've even did a study, I won't get into all the details here, about, okay, so we give them feedback for their reflective journals, but do they read them and what is meaningful for them? And that was a huge question. The person who asked me was Leo Rosenthal. She was a student of mine, and she said, no one reads the feedback. That doesn't matter. And I said, okay, let's check it. I don't know. You don't know. Let's check it. And she actually interviewed our medical students to figure out what works well in our feedback to those reflective journals. And we wanted to figure this out and to understand this. So we asked students to send us 2 meaningful feedback and 2 insignificant feedbacks. We didn't say to them what's meaningful and what meaningful or not, but they sent. And then she interviewed them. We actually analyzed those feedbacks. We didn't know which was meaningful and not meaningful when we analyzed them, but we wanted to figure out the components. And then she interviewed them to figure out their perspective about this. And what we have learned is that to become meaningful feedback for a reflective journal, you really have to encourage the student, because it's hard to be reflective. It's hard to share their vulnerabilities. It's not easy. So you have to encourage them. You have to express empathy, because they want to be treated as human beings. And this is part of answering your reflective journal. You want to focus on the content that they brought. So even if I see that there's another issue very important, first focus on what their issue. Later on, you can focus on your issue. You have to care and share your own experience. They've shared something personal. They love it that you say, oh, this happens to me sometimes, or that you say something that is reflective from your perspective or being touched. Develop reflection. Ask questions, but not too much questions. Ask questions that allow them to really think again about this issue, but be very aware of their emotional state. When I started teaching our physicians how to give feedback to reflective journals, I said, you have to use all of the, I forgot the word, but like question mark and punctuation and stop and so. And this is the issue. We can't only ask questions, because then they're overwhelmed and they feel like you're not helping them. So be aware to their emotions. Of course, avoid negative tone and keep an open dialogue. Check how it works for the student or what it brings them in. And amazingly, it brings to the word feedback by surprise. So I would say that reflective practice provides an opportunity for deeper understanding and growth. We have to use it in different spaces, and it shouldn't be very long. It shouldn't be the nights that I would wake up. It should be time capsule that I work through the stages. And the feedback and the dialogue is very important to improve reflection. And we need to create a safe space of being with the student. And then we can challenge them to think, to reflect, and to learn more. Though it is challenging and even difficult and time consuming, I believe that it's much more difficult to deal with the results of being unreflective. And that is the reason we invest much of our effort on this topic. So if you want, you can write in the chat or go into this barcode and write a little bit, a reflective piece for yourself. What was intriguing or surprising for you, or what you have learned, or what is your take home message from here today? It will go into the Mentimeter and then I can send it to you or in the chat. And one last thing is that I saw your questions. And one of the questions what will we do with AI now? AI, AI writes great reflective journals, and we sometimes don't know how to deal with it. And I would tell you that in the last year, what I developed is a Breaking Bad News reflective AI virtual experience that you can actually practice Breaking Bad News. And one of the things that I did that is different from most of those issues was adding a reflective feedback part. I didn't want to skip that part because I think it's critical. So even when our students practice breaking bad news with AI, they have the interviewer who asks them what went well and is very empathic and what didn't and why. And it's a huge part of our pieces, even when we move forward toward AI. So I've been talking your head off. Sorry, that's not a dialogic way of doing things. But I want to thank you for the invitation and for being here. And I want to thank my colleagues who were with me on these various projects.
Wow, Orit, you managed to do all the slides. We could never believe that it's possible in such a short time. We kept insisting that Orit cuts the number of slides, but she managed to do it. Like, wow. If I may, I mean, we don't have any more time left for questions, but I think you really addressed many of them. And I want to just do a summary of today's conversation. You started by giving us quite a bit of context about why it's important and how you you started to focus more on reflection when you understood that some students choose not to do things, and then the reflection is the way of learning why and helping them overcome their barriers. And also you mentioned at the level of doctors that the reflection needs to be developed because doctors are often working on themselves and don't get so much feedback, so they have to give feedback to themselves in a way. And you also talked about various advantages of reflective thinking in improving clinical skills and also decreasing the number of diagnostic errors and professional violations, and also increasing empathy and personalized communication. So you really made sound arguments for why it's important, and I was very touched how you talk about it was in the first class of your students, and basically. I think again it's about the weight of the skill, and by sharing what you have shared with us today and the reasoning behind it, you kind of share the responsibility for this learning with the learners. And then I think you talked about like the whole thing about the reflection as an exercise for the mind, and that in order to be fit, we need to exercise regularly.
Yeah.
And then probably the second big piece for me was how the reflective practice changes also the role of the teacher. And I think we talked a lot about how it's important to facilitate these discussions rather than to teach. And I thought it was really beautiful how you talked about the presence. So it's like when you teach, you are like an expert and you deliver your presence in the way of knowledge. And in this case, it's like you are an explorer and you get presence from your students. And I think this like switch from giving presence to getting presence is like a major mind shift in our profession. And then you mentioned the Gibbs model to give a bit more details how it works. But for me, this from giving presence to getting presence was like a really good description of how this changes our role as teachers, as facilitators in the classroom. And then maybe the third block of things was about time and the concern that there is not enough time for reflection and how to make it. And I just want to, I think this is one of the most painful places, especially like for Ukrainian educators, because we kind of like make a lot of time for exercise, but then we never have time for discussion. So I just want to re-emphasize a couple of points. If we don't make time, it will take and cost you more time later. And that do not do a simulation or exercise without budgeting enough time for reflection. And then when you reflect, to manage time, you need to be very strategic about what questions you reflect on. focus on what is important, and also your experience that basically the exercise itself lasts as long as the feedback session. I think also like very sound, like this is a priority.
It is.
And then I think like you were very generous in sharing with us how to help students learn the skills of reflection, and you talked about like the best way is to do it in dialogue, and basically creating space for students to discuss it in small or larger groups, what they have learned, to give them very clear instructions, to explain why this is important, not just give instructions. Also by giving feedback and by sort of creating this relationship between the student and the educator. And I think that also reflects the shared responsibility for learning that you started with. And then last but not least is your point about evaluation, and we also had questions about how can reflective practice be evaluated, and I think you also provided input into that. And last but not least, well, actually the next block was, I think, well, your discussion about how to do it with the feedback, FEEDBACK kind of ideas. I think that really gives an answer to the question how to move from criticism to reflection that helps. And I think this contained really a lot of ideas about how we could trace some of these things also as skills for ourselves. And I think last but not least, what was really fascinating for me to see is how you also integrate research and how you write about it, how you learn from your own experience. And in a way, I think for me, this was like the highlight, because you really teach what you preach and you do what you teach. I am especially grateful, and I know that you have written about it, and now it became very clear how you also use research to learn from what is happening and to improve your own teaching practice. And I think in that it was like a full package and a really big gift that we received from you today. So thank you so much for doing it also for the second time for us. It's a real privilege to do it. Maybe I just want to say that we are going to have our next meeting with Claudia Kissling from Germany. And I want to invite everybody to it. It will be on the 5th of December. It will soon be advertised. And we will talk about curriculum development and looking at the wholeness of curriculum development and integration into communication, into medical curriculum. And Claudia will really take a big picture approach to how it's planned and how to change curriculum. So please invite your administrators from your universities also to join us, because I think that will be a great discussion. And Claudia has worked a lot at the Charité and in Switzerland and in Germany, and many different clinics and medical schools to change this curriculum. So she's like a change management expert in this. And we will be really happy to have you. And with that, I want to wish you a quiet night and a good sleep at night, and also to thank you for coming today. Дякую дуже.
Thank you.
Thanks a lot.
Thank you.
До побачення. Бережіть себе.
Bye-bye. Stay